And welcome back. Thank you so very much for staying with us. We continue with the conversation on endometriosis, being the Endometriosis Awareness Month. Remember to continue engaging us on our Twitter handles at KTN News KE, at Grace Korea KE. I see a lot of your feedback here. We'll be sampling it, of course, at the end of the show. Now we continue with the discussion we had, Makami, Daktari, and Elsie here. And Doc, I want to start with you on the issue of self-medicating. I mean, even me, at times, when I experience the pain, I'll just pop some pills here and there just to ease the pain. Is it okay?
It's very appropriate to take some first aid medication if you feel pain, and it's the normal thing to do because medicines like paracetamol, perhaps aspirin, are available over the counter. The problem would be if you did this repeatedly without seeking to know what is the cause of the pain.
Okay. Take us through the diagnosis again, especially because there's something that Mukami mentioned before we took a break on laparoscopy. Just take us through the whole diagnosis. When when both of them went to, see the doctors, what did they go through?
So as a medical practitioner, you would want to fully evaluate a patient when they come through. So you are nearly aware of what could be the reason behind the symptoms. And if a girl or a woman has got pain, it does not automatically mean they have endometriosis, and they don't have to be worried that I'm going to suggest that they have surgery. The symptoms can point to a particular direction, and we could do some tests which could exclude very common causes. As you're aware, endometriosis presentation would come at around the time of puberty. Some girls may become sexually active. And that's also a time when you could be exposed to other conditions like sexually transmitted infections. So we do a full screen before we arrive at a diagnosis. We also do non-invasive tests, for example, pelvic ultrasound scan, which just helps us to see how the uterus or the womb, the ovaries appear. That type of testing could be indicative or it could suggest certain features that can make us think you have endometriosis. Now, an ultrasound scan of the pelvis is very good in picking severe forms of endometriosis, which could suggest that we need to do or suggest quicker treatments. When an ultrasound scan is normal, it's very, very appropriate to try medicines for a few months to see whether that can help without necessarily having to do an operation at the first instance.
Okay. Doc, let's talk about the symptoms, the signs and symptoms. Apart from this really excruciating pain, what are the other symptoms? What should ladies out there look out for?
It's very varied. And it's mentioned the cells of endometriosis will be found nearly everywhere in the body. So if you have endometriosis in your chest, you may not have symptoms in your pelvis. If you have endometriosis in your brain, you could have these cyclic convulsions or seizure activity. Endometriosis could also mean that during times that you don't have periods and you are sexually active, you could feel discomfort and pain. If endometriosis is on your bladder, you may feel pain when you're passing urine. And some women with endometriosis do not have pain or any other symptoms at all. We may also see that women who are trying for pregnancy and they're experiencing delay, a good proportion of them may be diagnosed with endometriosis, which could be directly linked to it or not.
Okay. Okay. Elsie, let me come to you, because before the break you told us about some of the effects that you mentioned, that some of these drugs could give you an effect, the side effects. What are these side effects?
I think the common one that I experienced as a result of taking the hormone suppressant, just to help people understand. So it's not only so once I was diagnosed, I was put on a hormone suppressant because endometriosis is a hormone-fed condition, and for as long as a woman's body is producing estrogen, the disease will continue to just progress, and the pain will be there. But I'm not saying, and I guess we can come back to that later, that hormone suppressants are the way to go. So for me, the hormone suppressant gave me very bad headaches, I had terrible insomnia. I couldn't sleep. I remember because of lack of sleep, the fatigue checked in, and it was it was perpetual tiredness that I could, even before I understood it, before I did the research to understand what I was actually going through, I thought that, my God, maybe I've become lazy, and then I started adding weight, and so all this weight, I usually say it's the hormone suppressant journey that I have gone through. And then the other thing, like Dr. Muteshi talked about, is sex was very uncomfortable before my third surgery, and I'll talk about that, I guess. And then the other thing that I also experienced as a result of also the drug was just so this is gonna be very, very delicate. I don't know how to say it. So there would be dryness in the vaginal area. So I wouldn't have the same kind of experience as any other normal woman would as a result of the hormone treatment.
Oh, okay. You did mention about like sex being very uncomfortable.
Yeah.
How did this affect you and your partner? Did it affect you in the first place?
So I remember, like, my first boyfriend, when I was sexually active, before I was first diagnosed, I remember, sex used to be so painful, but I used to think that it was okay, like it was okay, like it was normal, but I didn't realize that there was actually something wrong. But it did affect our relationship in the sense that I remember when I was first diagnosed, I was told I must prioritize having a child. And now I understand why they say that. But then I didn't understand. I was never given context. I was just told, now that you have endometriosis, you must get a child. And I remember I really tried to get pregnant when I was around 26. And my boyfriend couldn't understand, like, why are you making me, like, why are you forcing us into this whole pregnancy, baby getting journey, which we're not ready for, financially, the implications we don't understand. It did affect my relationship. For my marriage, my husband Harold, knew about, like, the fact that I was leading this cause and leading the foundation, and he understood, everything that I was going through, and we talked about it. We talked about the implications of the condition on my fertility, and even like sex and stuff like that. So he understood, and he's on board, and he's very supportive to date of the women. In fact, he's part of the volunteer team, and he keeps cheering us on as we go along.
Wow, that's really great.
Absolutely, but not every woman,
unfortunately,
has that kind of support. Yes, who suffers with endometriosis.
Sure. Makami, let me come to you. Let me get some of the effects that you got from some of the medication, and also, if I don't know if you're comfortable telling us about your sexual life. If you're okay with it, just tell us perhaps if it has affected you in any way.
So just like Elsie, after I went through my second surgery is when I was put on the hormone suppressant, just to make sure that my uterus rather cools down so that it can come back to normal and heal properly. So I remember the first time I got the injection, because it's a hormonal, it's a monthly, rather, for me it was a monthly injection. So I remember the first time I got it, I was having crazy hot flashes. Literally, you're going through menopause. That's what it is. That's what maybe Elsie didn't mention. You are going through menopause. So hot flashes, vaginal dryness, very irritable. I was very irritable and emotional. I would see something very tiny and maybe cry or get angry very quickly. Insomnia, I couldn't sleep. Migraines, I couldn't concentrate even at work. So I was just a mess, really. So it wasn't also a fun process, and I remember I was on the hormonal treatment for around 6 months. It did affect my sexual libido. I did not have a libido. Of course, the vaginal dryness is also very uncomfortable, but I also had very supportive partners, so it was also not hell for me. But as a woman, you feel like you know, I'm not being supportive also of my partner, and they also have needs, and you feel terrible. You do feel terrible. It affects you. And I remember I had to go through some counseling and therapy, and that's something that is also overlooked for women with endometriosis. It's a lot happening to your body and also to you psychologically as a woman. So also mental health is also now another facet that has to be included into the whole mix. So for you to also take care of yourself and not feel like you're worthless, and you know, the doctor really telling you, especially for example if you have what Dr. Mutishi called, maybe he'll expand on that, deep infiltrating endometriosis, something like an ovarian cyst, that you probably need to get pregnant quicker than other people. Just because sometimes your chances of also getting pregnant are, you know, limited, and it may be a challenge. It may cause a delay, not to say that you're infertile, but it may cause a delay. But we know a lot of women who, of course, go through the challenge of getting pregnant because of endometriosis. So it was a lot. So also just taking care of yourself mentally is important, I would say that. Yeah.
Okay. Doc, something that has come out from the both of them, and actually using Elsie's words, she says she was told, now that you have endometriosis, you must prioritize on having a child. Do you tell that to your patients? Is it really important?
I think importantly, we have to understand that endometriosis has different presentations, and women who have endometriosis are not invariably subfertile, or not all of them will struggle to be pregnant. In fact, a majority of women with endometriosis would be able to bear children. There will be a proportion of them, and depending on the extent of disease and how much scarring that may have happened in the pelvis, and also if endometriosis has affected their ovaries, that can have an impact. Now, it has to be put in the context of what treatments being planned. If you're having surgery and you have endometriosis on your ovaries, there is a very, very high chance that when we take away the disease from your ovary, normal cells from the ovary may be taken away, and they come away with the endometriosis. And that could affect your fertility in the long run. But we don't always say you must prioritize children, because we also know, whereas some women who may get pregnant may find relief after having a baby, some may continue to have pain from endometriosis. Now, as an endometriosis specialist, you have to be able to contextualize and say, what is the likely cause of the pain? And do I think that if I gave you hormone suppression, you will get better? And if you did, then we can continue with this, and for how long? The key question around that usually will be the desire for fertility. If you're planning to have a baby in the near future, then we have to work around that. If that desire is in the distant future, then we also have to work around that, knowing that we're not going to treat you with a method that may compromise your fertility, or we are not going to encourage a very long delay that may push you into subfertility eventually.
So it depends on the patients that you get.
Absolutely.
Right?
Yeah.
Okay. Let's talk about after the diagnosis. How do you manage it as a patient? The management of endometriosis after you're diagnosed.
Depending on the symptoms, and obviously we like to personalize care and discuss with the patients, because everyone would have different goals. You may find that fatigue is the predominant symptom, and we have to look at that, and not saying that the knife is going to take away your fatigue. We have to work around that and improve your quality of life. If pain is the most excruciating symptom, we know that if we operated on endometriosis, there is a good proportion of women who would get better after the surgery. But before the operation itself, the important thing would be to be able to determine the extent of disease, because the first operation is the most important operation. A lot of women with endometriosis would have had multiple surgeries just because of the complexity of the disease and how intricate it gets to operate. Some forms of endometriosis are mild, and they can be operated on by doctors who are appropriately skilled, and some forms of endometriosis are quite severe, that they may need to be referred to an appropriate center with skills that are capable to do that kind of job.
Okay. Dr. We'll talk about the treatment and the prevention later, but on the issue of management, still on that, Elsie, I want to know how now, since 2026, how you've been able to manage it until now.
Okay. So definitely one of the things is I've had to go through 3 surgeries because I think after every 4, 6, like after the second surgery, I think, so from between 26 and my next surgery, I was about 34. And then the next surgery after that was last year when I was 38. So that has been part of like my care, quote unquote, to just relieve the pain. And I think the procedure is called like an adhesion. It's adhesion.
Just dividing adhesion. So scar tissue, really.
Exactly. So they had to, so the doctors were giving me, wanted me to have that relief because they had seen the manifestation, and from what I kept telling them, they could see that, you know, I had painful bowel movement, and even just the first and the second surgery, they saw, you know, endometriosis in the rectal area. So another way that managed, of course, was hormone suppressants. The other thing is, now after my second surgery, I became very, very conscious and deliberate to understand further the condition. Because it wasn't enough that after my first surgery, my doctor, in fact, I usually tell this because it was so fun, the way he described it to me, was like my uterus was growing inside out. And so I had this story that I would go to work and tell people, you know, my uterus is growing inside out. Like, so, you know, I have like this, you know, this unique disease, and, you know, so I expected to be treated and to be understood. But, you know, so another way that I managed endometriosis now after the second surgery is I got into like trying out the endometriosis diet. So for a lot of endometriosis warriors, there are some foods that work against us and alleviate the inflammation and just make the inflammation very, very aggressive. So things like wheat. So, you know, I stopped eating wheat products. I stopped eating, I stopped taking milk because I was, you know, I've just realized that I was lactose intolerant. And then the other things is I stopped eating red meat. Then I also just, so there's a whole list of foods. I mean, like if you ask any endo warrior, like I think we get so depressed because when you realize, look, it's almost the list of all the foods that we cannot enjoy. You know, we can't eat spicy foods because of acidity, etc. All those things. So it's just, it was hard. It was tough. But you know, there are those days when you're just like, you're craving the fries, the oily stuff. I mean, we all know that as women, when we're going through the cycle, there are moments when our bodies are craving because of the hormone, the hormone imbalance, and, you know, so you crave spicy stuff. So of course there are those days, you know, like I'm just like, whatever, you know, this disease is not going to hold me prisoner. So let me enjoy a pain au chocolat, you know, let me enjoy a chocolate pastry. Like, you know, I'll watch my friends eating chocolate pastries, but I can't eat. But I'm like, no, that's unfair. Let me eat. Let me just enjoy. So a lot of the thing that I also did is just make sure that I started walking to induce the fatigue so that I could sleep, you know, so that, you know, so because this insomnia was chronic. I did a lot of research online just to understand how are women who are struggling with endometriosis just managing the fatigue. And so it took a lot of educating and empowering myself to be able to understand, okay, so this is what you have, this is how you manage it. And as I speak, it doesn't mean that what works for me is what works for Mokami. So even like when Dr. Muteshi is talking to Mokami, we both have endometriosis. The same, he won't give her the same management as he would offer me.
Okay, Mokami?
Yeah. So for me as well, like what Elsie has said, practically had to really lead a healthy lifestyle. At least I try for me going to the gym at least thrice a week just to make sure that I'm active and not always so fatigued and, you know, just trying to be normal, but keeping away from fatty foods. I'm also lactose intolerant. It's also like something very common amongst endo warriors. That's why we call ourselves endo warriors.
Yes.
Or wheat, or just oily food, spicy food, or sometimes you can decide, okay, I'll take that meal, but of course, you know, you will suffer later. So of course our diet had to really change and, you know, lead just a very clean, healthy lifestyle.
Okay.
Yeah.
Doc, something that has come out is the fact that it takes quite long to diagnose, or rather to have a correct diagnosis of endometriosis. So what is the worst case scenario if someone goes for years until you're 40, 50 without getting the correct diagnosis? What is the worst case scenario?
It's really the quality of life, because you will be, you know, trotting through with pain and other symptoms. Chronic pain is horrible, and it tends to cause symptoms of anxiety, because you're kind of anticipating every time your period comes, you're going to have pain. Because you don't understand why you are in pain all the time, you then go into the cycle of depression. So we see a lot of mental health problems with endometriosis. One of the other thing about chronic pain from endometriosis is that it's a nature of disease that evolves into what we would call central sensitization, which essentially means that your brain can learn to interpret things that normally would not cause pain to be painful. So if I touch your belly, instead of you feeling touch or pressure, then you feel pain. So if this goes untreated, then you're likely to live a miserable life.
Okay, okay. The two spoke about diet and the kind of foods that they currently cannot take. And of course, I'm aware of the fact that it doesn't apply to all, as Elsie said. But just expound on the diet. And also, if I could take you back to when we spoke about the causes, there's a question I always love asking about lifestyle. Is it lifestyle related? Could perhaps the diet that we're taking be a contributing factor to, you know, endometriosis?
We don't believe so, but there is coexistence of endometriosis with very common conditions. Lactose intolerance, for example, is nearly 60 to 80% common in the general population. And what it does is, if you take milk or milk products, then your body is not able to break it very well, and you feel bloated. The bloated in your bowels will cause stretching of scar tissue around endometriosis, and that can cause a lot of pain. So if you avoid milk products or milk itself, and you don't get the bloating and the stretching effect of it, then you're likely to get better. The diet would not be the cause of the endometriosis, but there is a lot of coexistence with other diseases.
Okay. Take us through the prevention and the treatment of endometriosis, Dr.
We'll be a long way if we knew how to completely prevent endometriosis, because then it will be like giving a vaccine. We are not yet there. However, we do know that if you are diagnosed early with endometriosis, you could take steps to improve the symptoms, and also ensure that if it's treated appropriately, it doesn't get complicated, and you're then not exposed to multiple surgeries, for example, and you know that if your fertility is at stake, you could take right steps in that sense. There is ongoing research to say if girls are given the pill at a young age with either menstrual symptoms of pain, or if their parents had endometriosis, could that prevent the onset of endometriosis? That data is not out yet, but we hope that there might be some exciting features in future. Now, our focus at the moment is to go out to young girls particularly and say, you know, if you've got these symptoms, please come out, so that we know you do not have endometriosis, or you have another diagnosis which can be appropriately managed. Because then if we give you appropriate treatment, and your pain symptoms predominantly are resolved, then you are able to function normally. You go to school, you go to work, and you'll be like anyone else.
Does it have a cure as of now? Can we get a permanent cure? Because we know, like, for instance, one, I call her, she's Njambi Koikai, I like calling her Jambi. She's currently in the US, you know, receiving specialized treatment, hoping to get, you know, a permanent cure. But can you completely get rid of endometriosis?
It's difficult to completely get rid of endometriosis. We know that women who go through the menopause transition may find that their symptoms have suddenly improved. And it's because the hormones from the ovary that drives the disease are suppressed at that point. So part of the treatments that we give, apart from surgery, would be to perhaps suppress the ovarian activity to the extent that your hormones are low enough to make you healthy, to form your bones and protect your heart, but not so high to activate the growth of endometriosis.
Okay. Doc, there's a question I'm getting from one of our viewers here. She's asking, as an endometriosis patient, how do you deal with sexual activity? Because what we're getting from the two ladies here is that it's really painful when it comes to, you know, when you're engaging in it. So how do you deal with the pain during the sexual activity?
It comes down to personalized approach, and we would want to know whether the difficulties that are experienced during that moment are due to the endometriosis itself, or could it be due to the treatments that we've given? For example, if you've taken hormones that have suppressed you to menopause state, and you are getting horrible side effects from that, then we could possibly change and give you something different that can help you. If it's endometriosis itself causing the pain and discomfort, it's more likely to be the more severe form of endometriosis, and therefore the approach to it will then be to remove that endometriosis, and a lot of women will get relief.
Okay, I need to get your closing remarks, 30 seconds, each of you kindly, but I'll also, Elsie, as I start with you, just tell us a little bit about the Foundation of Endometriosis Foundation of Kenya. 30 seconds, please.
So I started the Endometriosis Foundation in 2014 after my second surgery, because I was tired of not understanding this condition, and I just really wanted to give the same benefit to another woman and the same opportunity to another woman to be able to know that one, she's not alone, and to know that her pain is valid. And so we've been raising awareness you know, around endometriosis, and every month of March we celebrate endometriosis, and this 30th of March we'd like to invite everyone to Aga Khan Hospital, where there will be an endometriosis awareness open day happening, and I will be excited just to interact more. Just ask anyone who wants to follow the Endometriosis Foundation, can find us on social media. We have a platform and a space on WhatsApp and Telegram where we bring endometriosis warriors together just to share their journeys and just to encourage each other. But I want to affirm any woman who has gone through that struggle and just let them know they are not alone, their pain is not invalid, their pain is valid, and they are normal. That, you know, whatever they've been told as being abnormal is not true.
Normal. Mukami, 30 seconds, kindly.
Okay, I would just like to say that it's quite unfortunate that it takes the efforts of individuals to raise awareness on this condition, since it affects around 176 million who are diagnosed. So there are many more who are not diagnosed. So I'd actually like to say that if you know anyone who's an endo warrior, encourage them, be there for them, do not, you know, judge them. And then also maybe, for example, just educate yourself more on the condition. And we need more people on board. The government, for example, insurance, hospitals, everyone, just to come on board.
Okay, Dr. Your closing remarks.
My closing remarks would be mainly to encourage women to come across and discuss their symptoms with the doctor and be able to ask the questions to know what they're going through.
Perfect. Thank you, Dr. Ask the questions. That is what Dr. is saying to women out there. And of course, it's time for us to take that short commercial break. Of course, we've come to the end of our conversation this morning, endometriosis. And of course, to stay with us after the break, come back with international news.